So a lot of people use breastfeeding as birth control. Is that risky?
Well, it's no guarantee. I can tell you that, and all the patients I take care of who are currently pregnant and breastfeeding can attest to that. You know, people who are breastfeeding are supposed to not be fertile because breastfeeding is supposed to be a natural contraceptive by suppressing your ovarian function, because when you breastfeed, you make prolactin, which is the hormone to continue to create breast milk. And prolactin is supposed to be something suppressive to ovarian function, doesn't let you ovulate. I would probably say in the first 25 days after you give birth, that is true. After 25 days, it's anybody's guess. And a lot of that comes from, after 25 days, you may not be feeding on as regular a schedule as you were before. As time goes on, and maybe the baby slept a couple of hours and you said, oh, I'd rather have the baby sleep than me wake up and continue to breastfeed 2 hours later because now I'm getting a little break. Well, in that break, your prolactin level might go down and you may have an ovulation. So, there's a reason why we see people when we do after they deliver, and we try to catch them at a time where they haven't had sex yet because of a delivery, usually. And we try to count it out that we can remind them anytime after these 25 days, it's certainly potential. Now, I would say most people say to me, oh, I'm not having any sex anytime soon after my delivery for whatever reasons. But I always tell them, eventually the vagina forgets. And eventually you will want to go back there. Otherwise, every child would be a one-child family, right? So at some point, and you don't want it to be at that point where you say, never mind, I'm breastfeeding. And you're at a point where you might not really be protected. So I really encourage people after a certain point to be doing something, if they don't want to have another baby right away, to contracept in the near future, because, you're still getting to know that baby. Sometimes that's not the best time to have another pregnancy. So if you don't want that, you do have to actively do something to keep that from happening. I usually, condoms are fine to use at that point. The problem with using a condom at that point is that while these people were pregnant, they didn't have to think about it at all. So they may not have that condom handy, or they may be so used to not needing it that it may be an afterthought or something. But then, the baby is not an afterthought. So I would say in the last couple of years, I've had probably upwards of 10 women come in, not having wanted to be pregnant again so fast and still breastfeeding, and, they don't have a period. So we do a pregnancy test in the office and asking me, how could that have happened? I'm like, really? How could that have happened? Let me explain that to you. So.
And I was going to ask that too. I was going to ask, if you're breastfeeding and you haven't had your period yet, could you get pregnant? Because a lot of people think you can.
Right? Yeah. Until you start feeling a little bit of new pregnancy symptoms, which you could also feel when you're breastfeeding or postpartum.
Do you know much about the natural birth control? I've been hearing a lot more, especially online, about this natural birth control. I don't really know much about it, and I don't know how safe it is.
There's a lot of apps out there now, because I would say in the olden days, when I would have someone come in and they wanted to discuss their period, we would have to get out like an actual paper calendar gasp. Now people come in and I go, so when was your last period? When was the one before that? We're trying to track it a little bit. They all pull out their phones and they go, oh wait, I have that fertility app, or I have that menstruation app. So that's great in that way. So, and apps are good. I would have to say about natural fertility planning or using one of these apps, they really only work to the best of their capacity in women who have very regular periods. If you can time your period by, I got it on the 1st of the month, I got it on the 28th of the month, and I got it 28 days later and 28 days later, those people can use those apps. I mean, you don't really even need the app. You could use an old calendar or even your mind, because you can count. If you have a 28, we call it, the medical term for that is an interval. So if you have a 28-day interval, day 1 to day 1, then your ovulation is almost definitely, almost, not 100%, on day 14. So, fertility is like a 3-day window for eggs. So if you ovulate on day 14, I would say your danger days or the days to avoid, day 13, 14, 15. Maybe a day before and a day after also, but the rest of the month, you should be pretty safe. I would never tell somebody 100% because who knows, 1 month you have a lot of stress, you're in COVID, you're, whatever's happening, you ovulated at a different time. But if women have a very regular cycle and they know when their next cycle is supposed to come, they can use those apps with, I don't know what the percentages are. They can't be more than 90% just because of all the irregular usage, irregular periods, unexpected bleeding in between, you don't know. But there are some that I've seen that say that if you use it exactly properly and you have very regular periods, 87 to 89%. And, for some women who really do not want to use any type of other planning method, that might not be a bad idea. The problem is I have very few people that I can say absolutely know the exact date their period is going to come. And as we get older, that becomes less and less. Once you're over 35 and your ovulations start to change or become less frequent because over 35 and certainly over 40, people are less fertile. So when is your ovulation occurring? You don't know. And you may not know when your next period is going to come. So they're not usable in those people because you could put in all your information and this is when I had my last period and look at your cervical mucus and all the other things that you want to do. But if you really don't know when your next period is going to come, you don't know how to pinpoint your ovulation. Some people swear to me, I know when I ovulate because I feel it on my right side or I felt it on my left side. You may be feeling something. Can I guarantee you, unless I actually ultrasound you and keep that ultrasound on and watch the egg come out or something like that, can I tell you that you're ovulating on that day? I don't know. And then, of course, there are people who have longer intervals. What about the person who says, yes, it's very regular, but I have it every 30 days? Well, it's not mid-cycle for those people. It is 14 days before they're expecting their next period. So if it's 28 days, it's day 14. If it's 30 days, it's actually day 16 because the trip that we know how long it takes is from ovulation to next period. We know that's 14 days. So if you're really looking for your fertile time, I tell people, yes, if you have a 30-day cycle, look at the calendar or look at your app. When you're expecting your next period, count backwards 14 days. So you have to have some idea of when the next one's coming to know when your ovulation is. So if you have a longer cycle, again, maybe those apps work for that as well because you can plug in 30 days, 30 days, 30 days. But basically, then your time of danger or fertility would be day 15, 16, 17. So it moves later. And that is true. I'm sure you hear all the time people go, I have a longer cycle. And if they're pregnant, they go, I don't think my doctor's right about my due date because I have a longer cycle, and I know I ovulated at a different time. Yeah, the only people we really, really know when they got pregnant, it's people who have IVF because I know when they took that and put it in, right? Otherwise, we have to assume, look at the cycle, look at the size of the baby. We measure everything and count backwards.
That makes sense. Yeah, I have the cycle thing. I have the trackers and I do the same thing. Yeah.
Because otherwise, if I ask people and I go, okay, when was your last period? People usually know when their last one started, but then I get really tricky and go, when was the one before that? They're like, no idea. So those are good to, especially either people who are on natural cycle control or want to get pregnant. When should I try? I had a recent patient who came in. She's 36, told me she's been trying. And I said, okay, let's talk about the definition of trying. Are you just having random sex all the time? Because that's maybe fun, but it's not trying unless you're pinpointing your ovulation. And when she took out her app, or when we actually mapped it out, she had a 32-day cycle. So she was missing her ovulation if she wasn't having regular sex on a much later time, day 17, 18. We changed that, gave her it was one of my favorite things because that's education and information. The next month she came in pregnant. She said, I just needed to know the right days. And she's not dumb. It's a concept. And you have to realize that, especially if you have a traveling husband or partner or somebody that's not around at the critical time, you can have sex all the time. If you miss the critical day, you're never going to get pregnant. So.
That's true. And it's funny. I'm glad that you're actually bringing this up because my trying to conceive, they were like, okay, it doesn't matter if you're 28 days or 30 days. It's always going to be around day 14. And I know that's not true. And so, and you saying this is so like, because when you start tracking, like actually doing like the urine sample for ovulation, it does change. It is later and it's like 15, 16. And so when they're always like, oh no, it's day 14. No, it's not always day 14.
Right.
Like,
and you know what? A lot of people with that urine sample for ovulation don't realize that urine sample is not telling you ovulated. It's not like do the urine sample and let's go. That tells you that an LH surge. So that tells you within 24 to 48 hours, you're going to hopefully ovulate because you have the right stimulus that came from your brain to go to your ovary to tell it to ovulate. So if all the parts are working and you do that, then it's not a right away thing. It's like, I'm probably ovulating tomorrow. Let's wait. And then the next day is your best shot, you know?
Yeah. Which that's what I was told too. If you get that positive and it's like, okay, but it could be the next day or the next day. Like it's like a big window.
Right. It's a predictor. It's not like a pregnancy test that says yes or no, you are or not.
Yeah. Yeah. That's funny. There's so much stuff about that. And depending on what doctor you talk to, they'll tell you like different stuff. Some will tell you a couple days before or after. Some will tell you a few days. I had one doctor that was like, look, his ovulation time changes. Consider day 5 before you think it's going to be, and do like a 10-day window, and just in there at least every other day, you'll be fine. And honestly, that was years ago. I conceived from him telling us that when people were like a few days before and a few days, but when he's like, look at 10 days and just consider at least every other day, you're good. And that's how we got pregnant with our rainbow. And I was like, he was right.
Mm-hmm. Yeah. You have to have some concept of what's going on, ovulation wise.
Yeah. It's hard because, you think but you don't know. You don't know what's going on in there.
There's so much information out there.
I have one more question, and this is it goes into woo, but I'm sure you've heard it. There are a lot of people who want to take herbs to either try and control their fertility or to increase it. I don't know if you've heard a lot of that, but I have, and I was wondering what do people need to know if they're going into that, wanting to use herbs?
Do you have any particular names of the ones that people use? Because, herbs is such a wide category, and it goes all the way from things that if you took them, they won't harm you, but I don't have any scientific evidence that it will help you. So I'm not completely against it, to the things that are frankly dangerous for people.
Oh, okay. Vitex, evening primrose oil, wild yam.
I'm not really familiar with the first one, but evening primrose oil, actually, I do have quite a bit of experience, not so much as a fertility enhancer, but I have had people who take it for period problems, like cramps with their periods, what we call dysmenorrhea. Also for things like PMDD, like premenstrual dysphoric disorder, or PMS, premenstrual syndrome. And the reason that primrose oil might work a little bit for them is because it is connected in some way to the plant sources of hormones like estrogen and progesterone. So it's not like a dose that I can tell you, here's how much estrogen or progesterone you're getting out of this source. But some people do report back that it has made them feel either calmer or, has calmed down their menstrual cramps and things like that. So I'm not against people wanting to use it, but a lot of it for me, because I'm very evidence-based, and if someone comes into me and says, I am this age and I am interested in fertility and I would like to be pregnant by X date, I don't have any way to tell them that particular herb will make it any better or worse for them. But I do have people, taking it because I don't really feel like it has any evidence that would make me feel like it's really dangerous for them. And that's kind of my main concern. As far as something called wild yams, there's a very interesting historical point, is that, do you know that birth control pills were first made from the wild yam plant when they were very first invented back in, I forget the date now, but I wrote a recent article about this for Medium, about birth control pills in general. And looking back at the history of them, wild yams are connected to progesterone. It gives a progesterone effect. So they were noting that if they gave women, I don't know how much they gave them, how many yams, or how much you have to eat a yam to get a progesterone effect. But because they were originally made from that, they found that they have some suppressive value to your ovaries, like not so much for fertility, but more for suppressing the ovaries, and they would result in a contraceptive effect. And that's how they came to then chemically formulate that progesterone to be a component of the birth control pill. So again, I do definitely have people who come in telling me they bought yam cream and they're rubbing it on their skin and they feel really good. But for me, I am always kind of turned back to, like, I know the dose of progesterone that I can give you for the effect you want, which is better sleep or contraception, or to, balance out a high estrogen level if you're having very heavy periods and you might not have enough progesterone in your body. I know the dosages of things I can give you for that. So I tend to steer people in the direction of saying a known entity for safety's sake and for outcome is probably better. So I may not be against somebody rubbing the yam cream on there, but I would never tell them that will make you infertile or more fertile or give you contraceptive benefit or control your cycle. I can't say that for sure. So evidence-wise, I tend to move in the other direction.
I love this. I did want to note, Vitex is also called chasteberry.
Oh, chasteberry. Okay. So that definitely I have a lot of experience with as far as for people's periods. Again, chasteberry is a very well-known dysmenorrhea herb, and I don't prescribe it for people or tell them how much they should take, but looking at the evidence and looking at studies that have been done, I'm not against people using it if they feel like they take it and they have fewer period cramps or something like that. It's not something that's known to be dangerous.